So I attended that poverty treating workshop held in the month of June, and this was one of the most important and knowledge sharing workshop I have attended.
It was a workshop that I suppose everybody should attend. It just gives you a lot of insight.
The first thing which they mentioned was 211 number, which I was not aware of. The Service Ontario number, which tells you about if you need any medication and you are not having money to cover that, they will tell you about what are the resources you can get. Other thing which this mentions is that all the people, most and seniors, should be filing their taxes because they might get some rebate or their money back at the end of the year after they file the tax, and Service Ontario would let them know if they are eligible for other services which Government of Ontario is providing. After I told them about the 211 number, they really came back, appreciated, and they got a lot of help from that after calling that number.
The workshop basically was, again, talking about poverty, and so they had a poverty tool and assessing for poverty. Never did it very well initially, but then they gave me a tool to ask the question like, how are you making your ends meet? And I suppose that opened the gate up. It was an open-ended question, just opened the gate up, and I suppose the patients could even come and relate and talk about it, because I did notice there were some people who couldn't afford things, but they were hesitant to sort of address that question out there. So when you open the gate up for them, how are you making your ends meet? That sort of just opened the gate up for them.
In a normal office visit, I go through their nutrition and their living status, and that would tell me much more about whether they are at risk of poverty or they are already in poverty line. Assessing the status of people definitely helps in treatment, because treatment doesn't only mean that you are treating the people with the medication. It's a whole social as well as medicinal aspect of the patient.
It changes a lot of things. I first of all come to know about their finances, and as you know, the social determinants of health, poverty is a big one there. Initially it does take a little more time, but as the time goes on, I think I get more familiar with the patient, I get more familiar with the needs of the patient, and it comes back to your regular interview. Yeah. It does. So initially, like as the tool has screening, that's how the first question is, the screening tool. And then as I mentioned that when I find out about the poverty, I've got to adjust a little bit of things. I won't have normally done in a normal person, but when I hear the patient has issues with poverty, I would sort of screen him more for certain diseases in a much more stringent manner, let's put it that way. Yeah. And then, yes, and then the conversation moves on, like, how could I help you? What is available there, out there, and how can we make the most of those things out there? So it does change your practice a bit.
People who need some medication and they cannot afford, there are plans like Ontario Drug Benefit, Trillium Drug Program, and also there is some special drug program for few medications, and that can be judged by the specialist. If the people, like for instance, if a person is having interstitial lung disease, there is a medication which the specialist can go through with the patients, and that can be provided through this program.
The first thing, as I told you, like how you're making ends meet, that does really stand out for me, and that has changed a lot of things for me. And yes, the tools that are available out there, so it helped me to gain the knowledge about what's there. The Canada Benefits website, means which I could give it to the patients and they could look at there and they could see what they qualify for.
The reading material or even the few things which we were provided in that conference, if people can have just 5 to 10 minutes and go through that, it would be really helpful for them as well as for the community and their patients.
I think it's a good workshop. Even for the physicians who are the new physicians, they get to know about how to go about their forms. There are always questions that arise when the physicians are filling up the forms. Does he really require it? So those biases and all could be sort of dealt up, and you could talk about those things and how to deal with those biases. I think it's a worthwhile workshop, and I would sort of recommend everybody to attend it.